Hi class, my name is Miss Julie. I'm here to teach you about sickle cell anemia and SIDS. Here are some of the things we are going to cover in my class. Etiology, pathophysiology, nursing responsibilities, clinical management, and prognosis. Who causes sickle cell anemia in a child? Sickle cell anemia is caused by an inherited abnormal hemoglobin. The abnormal hemoglobin causes distorted red blood cells. Red blood cells change into a sickle shape. The cells die early, leaving a shortage of healthy red blood cells, and can block blood flow, causing pain. When oxygen is released from sickle cell hemoglobin, it sticks together and forms Long's rod, which damages and changes the shape of the red blood cell. How does sickle cell anemia affect the body? Obstruction occurs caused by the abnormal adhesion that is accompanied by the inflammatory process that blocks the microcirculation, causing vaso-occlusion. The absence to blood flow causes local hypoxia and leads to tissue ischemia and infarction. There's a lasting shortage of red blood cells. Without enough red blood cells in circulation, your body can't get the oxygen it needs to feel energized. That's why anemia causes fatigue. Sickle cells can damage your spleen, which is an organ that fights infection. This may make you vulnerable to infections. Sickle cells block the major blood vessels in the brain, resulting in cerebral infarction, which causes variable degrees of neurological impairment. So what is the prognosis of sickle cell anemia? Well, it varies, but most patients live into the 5th decade. Most children are without symptoms and participate in normal activities. Sickle cell anemia is a chronic illness with a potentially terminal outcome. Physical and sexual maturation are delayed in adolescence also. What is a nurse responsible for with a patient with sickle cell anemia? Teach the family to seek early intervention for problems such as fever of 101.3 degrees Fahrenheit or greater. Give penicillin as ordered and treat the child normally. It's the nurse's responsibility to teach the importance of adequate hydration to prevent sickling. You also want to recognize signs and symptoms of respiratory problems that can lead to hypoxia. Teach the parents the amount of fluids the child needs to be drinking, such as glasses or in bottles. Patients with sickle cell anemia have pain, so it's very important to prevent pain by administering pain medication when it is appropriate. Depression, anxiety, and fear may go with the disease. The nurse should make regular visits to discuss any concerns during the hospitalization and positive reinforcements of coping skills. If blood transfusions are in place, the nurse should monitor for signs of transfusion interactions. Record intake. This includes IV fluids and output. The child's weight is taken at admission to use that as a baseline to evaluate hydration. You also want to support the family, and you want to advise the parents to inform all trained personnel of the child's condition. What are some ways to relieve the symptoms of sickle cell anemia? You want to rest to improve oxygen utilization. You also want to give analgesics for the severe pain caused from vaso-occlusion. You want to give antibiotics to treat any infection. Also give vaccines because children are more susceptible to infection. And you want to give blood transfusions to replace sickle cells with normal red blood cells. You want to give hydration through oral or IV therapy. You want to give oxygen therapy if the patient's hypoxic. And you want to give ibuprofen for pain. Let's move on to the next section. What are some causes of SIDS? The real cause still remains unknown. One theory is the brainstem abnormality in the neurological regulation of cardiorespiratory control, which affects arousal and physiological responses to a life-threatening challenge during sleep. Impaired arousal responsiveness to increased carbon dioxide or decreased oxygen. A genetic predisposition to SIDS has been postulated as also a cause. In one study, a genetic mutation was positively linked to a syndrome of SIDS. Increased frequent and brief inspiration pauses, excessive periodic breathing, and impaired arousal responsiveness to increased carbon dioxide or decreased oxygen can also be causes. How does SIDS affect the body of an infant? It results in sudden death of an infant, which sometimes remains unexplained after a complete postpartum examination. Are there any treatments or medications for SIDS? There aren't really treatments for SIDS, they're more of a preventive measure. You want to place the infant in a supine position, you want to update the immunizations, and they also might do an autopsy to see what really caused the sudden infant death syndrome in the infant. What are the nursing responsibilities with an infant with SIDS? Nurses have an important role in modeling behaviors for parents to practice practices that decrease the risk of SIDS, just like placing infants in a supine sleeping position in the hospital. Nurses must be proactive in further decreasing the incidence of SIDS. You want to include postpartum discharge planning, you want to do the newborn discharges, you want to do well baby clinic visits, and you want to do immunizations visits, provide excellent opportunities to educate parents on this matter. As nurses, it's important to support the family, and you want to allow these parents to say goodbye to their child. You also want to help parents to explore their usual coping mechanisms, and if these aren't working, you want to investigate new approaches. As a nurse, you want to assess what the parents have been told about SIDS. You want to help the parents gain an intellectual understanding of the actual condition. How is the prognosis of SIDS defined? By definition, the prognosis for babies affected by SIDS is unfortunately death. The prognosis remains poor in these cases. How are sickle cell anemia and SIDS similar to one another? Although SIDS has an unknown cause, it could be that an infant with sickle cell anemia can become hypoxic, leaving the child without sufficient oxygen. Therefore, it could be the lack of sufficient oxygen can cause SIDS. Also, in sickle cell anemia, the sickle trait is inherited from one parent, which can be similar to what happens with the genetic mutation in infant with SIDS. Thank you for watching.
So an easy way to demonstrate what sickle cell anemia to a kid is, or to anyone for a better understanding, is you can grab whatever, a long tube or whatever it is. I just made this out of cardstock, and I just made an opening so you can see what goes in through the tube, but this is to resemble a blood vessel. So these are what we call the red blood cells, the normal red blood cells, normal hemoglobin. So then what they do is they easily pass through the tube and easily through the blood. That's what it resembles. But now, whenever you have the sickle cell trait or sickle cell anemia, it turns into like paper clips. The hemoglobin, the inherited hemoglobin, turns into abnormal shaped red blood cells. And whenever they're passing through the blood, they tend to come together and connect to each other, and don't let the red blood cells pass so freely. So whenever it goes through the blood, they'll clump together and they don't pass so freely, just like the normal red blood cells that we saw. And that's a way to explain sickle cell anemia to a child or to anyone that needs a better understanding.